The physiotherapy programme here at RGU has been running for a number of years, and a number of the staff therefore are very established in delivering a unique way of how we learn physiotherapy techniques. The main emphasis on this course is practical application of learning, and therefore as part of our delivery there's very few times we're in a lecture theatre for 2 hours where there's people like myself telling you how to do things and only this is the only way to do that. Suffice to say, the course, this is not a recipe-based approach to learning, and we have a different philosophy here where it's all about practical application of learning. This has an implication on how our students learn and how students engage with the learning material that we have for the course. Very much the ethos here is what you're going to do and making sure that the assessments and treatment meet the needs of your patient, and therefore the philosophy is that there's not one size fits all. The example I commonly use during the admissions process is you may have somebody that requires a total knee replacement, and this could be a 15-year-old child with juvenile chronic arthritis, so due to the nature of their condition they need their knee replaced perhaps in their mid-teens. You could also have a retired elite athlete in their mid-40s that requires a knee replacement because of maybe they've been a triple jumper which has caused excessive damage to their knee over their professional career. And then you perhaps got the 70-year-old gentleman who, as it, with the ageing process, requires a knee replacement. So while those 3 individuals can have their surgery on the same day by the same consultant, they're all going to require quite a unique approach to their therapy. A 15-year-old, for example, may not appreciate a Zimmer frame, whereas your athlete may be very keen to be motivated to be active, but when they've just had surgery, the skills may be thinking about slowing down that rehabilitation phase. Where somebody in their 70s, the likelihood is they're going to have another condition coexisting which may have an impact at the speed and the rate and the pace which you can progress their rehabilitation. So the ethos here on the course is to think of, rather than this is how you manage a total knee replacement, it's thinking about what are the key assessment principles a student would need in order to assess a knee, what are the key treatment principles, and then through more of a case-based approach to learning, we're trying to get students right from the go-get of this programme is to be able to select the right treatments for the right patient at the right time. So more akin to what you're going to be expected to do when you're treating patients out there in clinical placement. By the very nature of that, it's very rare that you'll be sitting in a lecture theatre, and indeed across the 4 years I think you'll be in a lecture theatre for about 10 hours. So therefore, when we're looking at the course structure that we have here, there's a big emphasis on workshops and small group tutorials, because again this environment helps students apply that learning rather than listening to me saying this is how you do it. This course philosophy of case-based design, inquiry-based learning, problem-based learning is instilled right from the outset of the course, which is again partly why we interview, because we're looking for people who have problem-solving skills, and this is integral when we're thinking about how they're approaching their studies. So right from the beginning of the course, we're more likely to give students key principles, give them self-directed study, which we expect them to come to class perhaps having a good insight into pathology, and then the focus of the class is thinking about what impact would that pathology have on an individual, what are the key things you'd want to assess and why, and what impact do you think that pathology would have on their function, and what impact would that have on our choice of treatment. So my role, rather than a lecturer, is more somebody who helps with application of knowledge and facilitation of your knowledge throughout the course that you're here.